I'm Steve Holland, professor of economics at Luther College, and I'm grateful to Luther's Center for Ethics and Public Engagement for organizing this opportunity for me and many of my colleagues across Luther's campus to reflect on how our disciplines approach the many questions raised by the COVID-19 pandemic. The economic impacts of the pandemic are getting nearly as much attention as the health impacts, so there are a lot of interesting things for economists to talk about. Why did the stock market decline so rapidly, and why is it coming back? Are the fiscal measures being taken by Congress and the monetary policy being implemented by the Federal Reserve enough? What's going to happen in the oil market? Why is there a toilet paper shortage, to name just a few? Today, I want to offer a few ideas about what economics might contribute to the debate, which has been in the news a lot the last few days, about whether to continue stay-at-home orders or to begin reopening the economy. The trade-off here is familiar to everyone. We need to try to flatten the curve by staying apart, but that means that most of us can't go to work, we can't go to the store, we can't use public transportation of any type, and this is having historic effects on the economy. Reliable statistics are still weeks or maybe months away, but we do know that claims for unemployment have risen by a factor of about 10 over the peak of the Great Recession, and that about 22 million people have filed for unemployment over the last 4 weeks. That number almost certainly understates the total number of people who have lost their job. We also lack up-to-date statistics on economic output, but we do know that economic activity has fallen dramatically. Transportation, retail, restaurants, and many other sectors of the economy saw a brief surge in sales, for example. But since stay-at-home orders have become the norm, these industries have seen enormous reductions, somewhere in the range of 50 to 90%. This kind of shock to the economy has a snowball effect. In this case, the threat of COVID-19 caused people to avoid congregating. That meant employees could not go to work, customers could not shop, so businesses shut down first in China and then in much of the rest of the world. Supply chains were also affected, so businesses around the world could not get supplies, components, ingredients to produce their goods, even if they were able to operate. The shock then caused business revenue to fall, which caused businesses to lay off workers. Households, again, after a brief period of stocking up on canned goods and toilet paper, began to spend less, either because someone in the household lost a job or because of a fear that they would. Businesses also responded to this uncertain future by reducing investment, drawing down inventories. As households and businesses spending in households and businesses fell, businesses had less and less reason to continue producing their products, so output falls even further, which leads to further reductions in employment, causing households to save more and spend less, and so on and so on. Our uncertainty about the future only exacerbates this negative feedback loop, and this makes it even more difficult for an economy to pull out of the slowdown. While the narrative is familiar from previous economic crises, this particular crisis may be much different because of its size and its suddenness. There also seem to be more questions about the effectiveness of macroeconomic policy. The usual remedy for recession is to implement policies to get people back to work, but in this case, we want workers to stay home. On top of that, low, sometimes negative interest rates around the world are also likely to make central bank policy much less effective. For these reasons, the near term looks bleak, but it's much more difficult to guess what the long-term impact of the pandemic will be. Predictions about the economy should always be suspect. As John Kenneth Galbraith once said, the only function of economic forecasting is to make astrology look respectable. Nonetheless, predictions currently abound. In fact, a few days ago, the International Monetary Fund predicted that global GDP would fall by about 3% this year, which would be the largest drop since the Great Depression. The vast majority of that reduction would come in advanced economies like the United States and Europe. And by comparison, the global economy contracted by less than 1% during the Great Recession of 2008 and 2009. A recent National Bureau of Economic Research paper predicts the U.S. economy is probably going to be down about 11% compared to where it was last year. Given the potential magnitude of the economic impact of a lockdown, there are very understandable questions about when the stay-at-home order should stop and we should get back to business. President Trump on March 23rd tweeted that, quote, "We cannot let the cure be worse than the problem itself." On the other hand, public health officials are telling us not to lift the restrictions too soon and risk another surge of illness and death. Governors across the country are now forming task forces to determine how and when to begin the process of getting back to normal. I believe economics can be a useful tool in this debate. Economists study choices. We study trade-offs and how people, including policymakers, decide how to make the best use of their resources and their time when those things are in short supply. So economics should have something to say about this terrible trade-off between the harm caused by the virus and the harm caused by trying to slow the virus. Over the next few minutes, I plan to share a few thoughts about this. I'll try very hard not to make any predictions. In fact, I'm going to try to avoid giving any answers at all. But instead, I'm going to raise 4 questions that I think would be useful whilst we explore the balance between the public health and the health of the economy. My questions are intended to push the discussion beyond aggregate measures of GDP or the level of the S&P 500, which miss big differences in how the pandemic affects us and tend to ignore many of the things we actually care about. First, I think we need to examine how different sectors of the economy are being affected by the virus and the shutdown. The virus and the stay-at-home orders that are intended to mitigate it do not affect all businesses the same way. So the decision to relax these restrictions are also going to have disparate impacts on business, their employees, and their customers. As a result, it's going to be important to distinguish the source of the harm on an industry-by-industry basis. So, for example, some industries have been terribly harmed by the shutdown. We've all heard stories about the effect this is having on airlines, on hotels, restaurants, and other businesses. Banks and landlords who in coming months are going to be receiving far fewer mortgage payments and rent checks than usual may be the next to join this group. These businesses are almost certainly going to be helped by a quick return to normal. Other industries have avoided being closed by stay-at-home orders, maybe because they're deemed essential services, but they've been devastated by the virus itself. Nursing homes are an obvious example of this. Others are a little less obvious. The other day, the New York Times reported on meatpacking plants being forced to close because the spread of the virus among their employees who work in close proximity to each other and for obvious reasons cannot work from home. This has had a ripple effect because as processing plants close, farms and ranches have nowhere to sell the animals that are now ready to go to market. Lifting restrictions meant to slow the spread of the disease could make things even worse for these businesses if it means that people continue getting sick. The impacts on other industries have been counterintuitive. One of the primary reasons to encourage social distancing was to avoid overwhelming hospitals with COVID-19 patients. While this approach has proven wise in some places, many hospitals around the country are currently sitting empty as elective procedures have been canceled. Patients with more routine ailments are avoiding trips to the clinics and hospitals where they might be exposed to coronavirus. Many hospitals, especially those in rural areas, might have a difficult time surviving much longer if the stay-at-home restrictions stay in place. Still, other industries have done extremely well at this time. Netflix, Clorox, and Zoom are all really good examples. The other day, I visited one of our local bike shops and learned that they're not able to keep up with requests for tune-ups, and bike sales, especially of kids' bikes, are extremely strong. And then finally, there are other businesses that could have done really well had they been able to stay open. NPR recently did a story on a jigsaw puzzle manufacturer in Massachusetts whose sales rose by more than 300% before they had to send their employees home and shut down operations. Local bookstores, which have been facing very hard times in the last few years, also could have benefited from the millions of people staying at home, but most of them have also been forced to close. So some, probably most, industries will be much better off after social restrictions are lifted, But others, we have to recognize, are going to be more susceptible to resurgence of the virus and will benefit from continuing restrictions. The second question I think we need to ask is, how are people of different income, race, and gender being affected differently by the coronavirus? It's been fairly well documented that the pandemic is causing a disproportionate amount of pain for the poor. Pandemics are regressive. The poor, at least in the US, have less access to affordable health care. They often work in close quarters and are less able to work from home. They're also more likely to live in small apartments in big cities. All these factors make the poor more likely to contract the virus and less able to recover from it. States in the South and some northern cities like Detroit, Chicago, are reporting much higher infection and death rates among African Americans. It's a bit early to fully explain this, but a large part of the explanation is undoubtedly racial inequality. Blacks are more likely to live in cities and are more likely to work in service industries that put them in closer contact with others and do not offer the chance to work from home. African Americans are also less likely to be insured, and as the New York Times recently reported, they're often subject to racial bias when they seek medical treatment. The homeless are at an even bigger disadvantage. A person obviously can't shelter at home unless he has a home. Homeless shelters, which are tightly packed and offer only shared bathrooms and common spaces, are fertile ground for the spread of the coronavirus. New York City has reported hundreds of positive tests for coronavirus among shelter residents, and over 20 have died so far. If there are racial and socioeconomic disparities in the rate of infection and death, that seems to suggest that tighter restrictions that slow the spread of disease should reduce some of those differences. The same groups that are more vulnerable to the virus also happen to be the groups that are more vulnerable to an economic slowdown. The jobs most likely to be at risk, those at this end of this chart, are those in manufacturing, retail, service industries like hotels, restaurants, and the like. These industries also tend to employ lower paid workers, part-time workers, and contractors. They also employ more women. NPR reported that among the workers in the first wave of pandemic job losses, 60% of them were women. So pandemics also appear to have a gender component to them. Of course, losing a job involves much more than just losing a paycheck. Economists Ann Case and Angus Deaton have written extensively on what they call deaths of despair, which they define as deaths from alcohol, drugs, and suicide. Deaths of despair have been rising in the United States over the last 20 or 30 years, as we move to the right in these charts, primarily among white, middle-aged men without a college degree. So in this age range, between 30 and 60, the number of deaths of despair have gone up quite a bit. This is especially true in the South and in Appalachia. Case and Deaton argue that rising inequality, stagnant middle-class wages, less job security, inadequate health care, and many other factors have made it much more difficult to live in the middle class. And since these are the people more likely to lose their jobs in an economic downturn, the longer this thing goes on, the more likely it is we're going to see more of these deaths of despair. Third, to what extent are people going to resume normal activities when stay-at-home restrictions are lifted? Many people pressing for a quicker lifting of these restrictions seem to be assuming that everyone will immediately rush back to work in shopping malls, but this may not be true. We currently face an unusual amount of uncertainty. The relatively low level of virus testing leaves many of us wondering who of our neighbors has the virus. Stories of COVID-19 rebounding in China, Singapore, and other places heightens this uncertainty. Social scientists have long understood that people do not like uncertainty and are going to take unusual measures to avoid it. There's an idea frequently evoked by economists called the Ellsberg paradox. This paradox states that people overwhelmingly prefer situations where they know the odds over situations where the odds are unknown or ambiguous. And this is true even if the known odds are clearly against them. In other words, the Ellsberg paradox explains why we tend to choose the devil we know. So when society emerges from these stay-at-home orders, we're still not likely to know much about the potential for the virus to make a comeback. As a result, there's likely to be quite a bit of fear, and people might choose to stay home even if it means they're not able to earn a wage. The devil they know, in this case losing income, might be preferable to the devil they don't. As evidence of this, the media's reported quite a bit in the last few weeks on polls that show people are going to be very hesitant to book a flight, go back to work, or attend a sporting event after restrictions are lifted. If this is all true, the optimistic predictions of an economic boom might not materialize. The last question I think we should ask is there really a long-run trade-off between the public health and the health of the economy? This particular question is extremely difficult to answer while we're still in the middle of the pandemic, but looking back at the Spanish flu outbreak of 1918 might offer some insights. A paper that came out a few weeks ago looked at how various responses to the 1918 flu impacted different city economies. And what the authors found was that cities that responded to the pandemic most aggressively, those would be the blue dots on this chart, had fewer fatalities, to the left, and less severe economic outcomes, higher points on the chart. A nice example is a comparison between Minneapolis and St. Paul. Minneapolis, which is right here, took aggressive action to close schools, churches, and other public spaces. St. Paul, which is right on the other side of the Mississippi River and is this pink dot right here, took a more relaxed approach and did not close for another 3 weeks. The study showed that the mortality rate in Minneapolis was lower, 388 deaths per 100,000 people versus 481 for St. Paul, and Minneapolis emerged from the pandemic in a much better economic condition. The authors conclude, quote, "Altogether, our evidence implies that pandemics are highly disruptive for economic activity. However, timely measures that mitigate the severity of the pandemic may also reduce the severity of the persistent economic downturn," unquote. If this is also true for the coronavirus pandemic, there may not be a trade-off between public health and economic growth, or at least in the long run. Put another way, if the virus itself has a greater negative impact on the economy than the restrictions intended to slow it, then a more careful approach to restarting the economy might be wise. So thank you for taking the time to listen to these reflections. Thanks again to Luther's Center for Ethics and Public Engagement for organizing these videos. Take care.